To care for Mrs. Krimov, who has no aid or help in taking care of her stomy bag, you should wear your gloves. You should have your gown on to protect your clothing from spillage. You should also make sure you have your mask on. You should have your discharge pan. Then you should have 2 petri dish, one with wet wipes and then the other to put the used wipes inside in your tray. Good day, Mrs. Krimov. How are you doing? I just checked your care plan and I realized you just had an ileostomy. I hope you are feeling much better. Okay, so I'm here to discharge of your outfit. So then I'll draw the curtains and then wash my hands and get us ready for the procedure. With my hands washed, sanitized, and my gloves on, with the curtains drawn for privacy, we then begin. Care must be given 4 to 6 times in a day, and it should be usually done before breakfast. I'll take a pillow to elevate the head of my patient. Madam, could you please raise your head a bit? Yes. Are you comfortable? Sorry, please raise your head. Are you comfortable? So then I forgot to add a towel.
The towel will serve as a barrier for the patient's skin and then her clothing.
I'm really sorry, madam, for the inconveniences. So then you open the bag and then discharge all the material and press down. Normally the patient is supposed to sit upright, but since our patient just had a surgery done, she's not feeling too well to be moving. And then you use your wet wipes and then you clean the outside. And then you close it back. While I was doing this, you check the sites for redness, swelling, or irritation. Madam, are you okay? So then you dispose, you change your gloves, you take the towel from the patient, cover her, and then you then remove the other pillow, and then you position this one well. Please come down a bit. Position the other pillow. Please, would you like anything? Are you okay? You're comfortable? If there's anything, please call us. Thank you.
With permission sought.
Mrs. Krimov, you realize that the discharge has changed color and is reddish. You then report immediately to your nurse and supervisor. You also realize that there's redness and a bit irritation, and your patient is also very warm to touch. With all these signs, you should report immediately. What is ileostomy? Ileostomy is a permanent artificial opening of the ileum that drains through a stoma on the surface of the abdomen. 1. Ileostomy is the permanent artificial opening of an ileum through the drainage of the stoma. And then colostomy is the opening of the colon that drains through the stoma on the surface of the abdominal wall. 2. Ileostomy requires the total removal of the large intestine, whereas colostomy requires the removal of the portion of the intestine that has been affected. 3. Ileostomy is a permanent activity, whereas colostomy can be permanent or temporary. 4. Ileostomy, the drainage is a liquid feces, but for colostomy, depending on the location of the stoma, the feces can be mushy, semi-mushy, fluid, and semi-fluid.
Image showing the type of feces for each part of the colon.
Also, the differences between ileostomy and colostomy in terms of the bag. With colostomy, since most of the feces are between semi-formed to formed, the bag is in one piece with no drainage outlet. But then with ileostomy, since the discharge is liquid form, the bag has a drainage outlet.
First, colostomy bag. Second and third, ileostomy bag.
Materials to expect from the stoma is liquid feces. An appliance is a device used in ileostomy to collect the drainage from the stoma. An adhesive opening adheres directly to the skin, which consists of 2 pieces. That is a flexible rubber ring, that could be the barrier accessories, and the bag that snap onto the flexible rubber ring. Signs and symptoms to report immediately: skin redness at the site, skin inflammation or irritation at the site, leaking at the site of the stoma, dehydration, signs of infection like fever, And also, when there's change in color, character, amount, and frequency of the stool, it should be reported immediately to the nursing supervisor. Possible complications of ileostomy are wound infection, stomach bleeding or retraction, obstruction, dehydration, and inflammation of the pouch, that is pouchitis.